Welcome to my YouTube channel. Today we're in October. October is a month where we wear pink. As you can see, I'm in pink. Why do we wear pink in October? It's breast cancer awareness. What's our focus? We want to create awareness on breast cancer, its signs and symptoms. We want to create awareness on its incidence. Why is it important to get screened? And how does one get treated for breast cancer? And a little bit about survivorship once you've been diagnosed with breast cancer. So let's begin with, what is breast cancer? Breast cancer is a cancer that starts within the breast tissue. A cell stops behaving normally. A normal cell should be able to form, grow, develop, and divide, and later on die off. However, when cancer occurs, the cell does not have that normal lifespan. It becomes irregular. Its division is not regular. Its DNA is altered, and it forms a bunch of cells, daughter cells, that are abnormal, and that forms a mass, and that can be palpated. So women at a higher risk of getting breast cancer because we have more breast tissue, but men have breast too, and men can get breast cancer. We have about 1% of men getting breast cancer. So this message is both for women and men. So when you talk about breast cancer, what are we really talking about? What are the symptoms to look out for? One, you might find that the breast is increased in size than the other contralateral breast. You may find that the skin has changed. It's becoming like an orange with dimpling on the skin. The nipple may be retracted, pulled in, and that's a sign. And when you press the nipple, you might find that there is breast discharge. And when we palpate and try feeling around your breast, you may feel a mass, a hard substance, like rock-like within your breast. If you have any of those symptoms, what should you do? It's very important for you to visit a healthcare professional. If you're above 40 years old, the expectation is that the doctor will write for you a mammogram. This is a scan of the breast. It helps us identify the lesion within the breast, look at its characteristics, and know whether it has a suspicious look or a normal look, a benign look. A mammogram will help the doctor know whether to advise you to go for a biopsy or to continue with normal screening. If you have a breast mass and you're below the age of 40, then the recommendation would be we do an ultrasound. Why can't we do a mammogram in someone who's below 40? Breasts are dense, and when breasts are dense, it's not possible to visualize the lesion using a mammogram. So, for women who have dense breasts above the age of 40, what do? We can send them from an MRI of the breast that will enable us to see within it. So when you talk about screening, we're talking about you're healthy, you're happy, you're at work, you're doing your life, but you dedicate time maybe every October to go to have a breast examination. You have no symptom, so you go for screening. It is really important to go for screening, and that's why October, kindly wear pink ribbon, talk about breast cancer, and by doing so, you will be able to save lives. So what is our focus in October? 1, talking about breast cancer. 2, encouraging women to go get screened. And once you're found with breast cancer, what should you expect? 1, we will do scan, a chest CT scan, an abdominal CT scan. And what are the scans to assist us? They're to help us know the stage of the cancer. Is it only in the breast or has it moved to other organs? Once you've been staged, management can be able to start. How do we manage breast cancer? There are very many modalities that can be used. I'll talk about them in general. 1, you may need to have surgery at one point after your diagnosis of breast cancer. It could come before or even after other treatment. You could also be given hormonal treatment. Some get a tablet that they take every day, either tamoxifen, letrozole, anastrozole, a tablet you take to reduce the estrogen levels in your body, especially if the type of breast cancer you have is estrogen sensitive. You could also get chemotherapy. Chemotherapy targets rapidly dividing cells, such as those found in the tumor within your breast. That can be prescribed by a doctor. So what do we say? Breast cancer diagnosis is not the end of life. It has good outcomes, especially when we catch it early. So what's the message for October? Let's talk about breast cancer. Let's get screened and let's get treated should it be diagnosed as breast cancer in us. Okay, thank you very much for joining. See you in the next presentation.